This Turkish restaurant in Seoul's Itaewon neighborhood is among dozens of businesses that reopened recently after weeks of lockdown. But customers are shying away from the usually bustling neighborhood after a cluster of coronavirus cases was discovered here.
The effect is quite bad for us because we've been losing our customers for 3 days, especially weekends when our restaurants are quite busy. So in Itaewon we have 5 branches and we can see decreases in all 5. So it's quite affecting very badly our business.
The virus spread to at least 120 people from a single carrier who partied in the area last weekend. Officials have responded by shutting down 2,100 bars and nightclubs in the city. But even those allowed to remain open are suffering.
Since the outbreak, most of our regular customers, foreigners, keep coming back to us. But unfortunately, the locals started abandoning this whole area, even though the cluster was on the other side of this specific district. And as you can see, most of the bars are shutting down temporarily or permanently. And it's just really affecting this side of town, even though there is no recorded cases in this side of town.
More than 100 new cases have also been reported in China, prompting partial lockdowns in the northeastern cities of Jilin and Shulan, where COVID-19 clusters have appeared. In Wuhan, where the virus is believed to have originated, officials are taking extra precautions, testing the entire population of 11 million people.
I don't think there's going to be a second wave of COVID-19 in China. We have gathered experience in curbing the spread of coronavirus over the past 3 months. And this experience will help us. A small number of cases will not reach a certain scale of the epidemic.
Despite these assurances, as China tries to get back to normal, the enduring uncertainty continues to put businesses and livelihoods at risk. Mobin Nasir, TRT World.
Well, for more, let's go to Jonathan Marks in Pennsylvania. He's the Bioethics Program Director at Penn State University. Welcome back to the program, Jonathan. Now, as we heard, there's disturbing developments in countries like Germany and South Korea with new outbreaks of coronavirus infections. These are countries that were really hailed as success stories in terms of containing the outbreak in the first place. It really does underscore the dangers that authorities face as they attempt to reopen their economies, doesn't it?
Absolutely. And as you said, I'm based here in Pennsylvania, and I heard in my college town last night students beginning to party after the stay-at-home order was lifted here. And I think it's a salutary warning, the case in Seoul of one person partying and spreading it to 120 other people, that we really do have to be much, much more careful. I understand the frustration that people have having been locked in their homes, but without more containment, without more extensive testing, and without more contact tracing, I think we are likely to see not just second, but third and further waves of this virus, unfortunately.
And we are seeing this push in your country, in the US, across the country, where the state governors and even the president are really looking to get the economy back on track, with Donald Trump even warning, in his words, that the cure shouldn't really be worse than the problem itself. Now, how do authorities, or how should authorities really balance this fine line between personal freedoms and also the desire to earn a living versus containing this health crisis?
So I certainly recognize that this is not an easy challenge, balancing the needs of the economy and the demands of protecting public health. But I do think we can be more creative in thinking about how to resolve this tension. So indeed, I think I heard a colleague here who has expertise in the food industry saying we could actually be using restaurants in order to make food for people who are poor and need that food, and that could be funded by government. So you would keep restaurants alive, and you would also provide sources of food to communities who are at or below the federal poverty level, especially now that they're unemployed. So I think there are creative ways of doing this, but what we need in this time is to recognize the essential role of government in promoting and protecting public health. And part of that will be required, they'll be required to think about ways in which to buoy the economy while ensuring that public health is also protected.
And of course, one thing that will solve all of these problems is an effective vaccine. We're told that dozens are currently in the works. What sort of progress is being made towards that?
So you're right, there is work on vaccines, but the bottom line is a vaccine is not going to come soon enough to prevent a second and probably not a third and maybe even further waves after that. So we can't rely on a vaccine. Although obviously I hope, as everyone else does, that the vaccine is developed as soon as possible. But that might be at the very least 18 months, maybe 2 years, maybe longer. I am extremely worried also about this push towards creating immunity passports or immunity certificates to facilitate people going back to work. The science simply doesn't support issuing certificates to people indicating that they are immune and or no threat to others. The science is simply not there. And I worry deeply about putting in place such measures, not just for their likelihood of exacerbating the public health crisis that we're currently facing, but also for the kind of impacts, broader social impacts that these kind of immunity certificates might have.
Interesting. Now, we're also hearing reports that the French pharmaceutical giant Sanofi, which is currently working on a vaccine, has agreed to essentially let the US have first dibs on any successful vaccine that they might come up with, because they say the US has funded them from the outset. Now, this poses an ethical problem, doesn't it, when other countries are being preferenced over the rest of the world, essentially, when it comes to a vaccine?
Absolutely. And the allocation of scarce resources in the time of a pandemic is one of the most challenging questions in public health ethics. But you're absolutely right. We need to focus on those communities, those countries that have been most adversely impacted, especially when populations are affected because of historic social and structural injustice. And that should be the way of thinking about an important part of how we think about allocating scarce resources like a vaccine when we have one, rather than thinking about where did the money come from initially and the like. Well, we've already seen the disproportionate burden of COVID-19 on communities of color, on vulnerable populations, on prisons, on people in nursing homes. And so we have to start thinking, I think, more deeply about how to allocate a vaccine when we finally have it.
Okay, Jonathan Marks from Penn State University, thank you so much for sharing with us your analysis.